So good morning, good afternoon, and good evening. Namaste to everyone and a very warm welcome. I think before we start, may I have Natalie show the next slide? Yeah, so in case anybody needs any translations, please make sure to activate your auto translate captions. Under the under the CC, it says shows captions, and you can choose your language that you would need for translation. So today we are gathered, and today is the final symposium of the World Burn Week. This week, which has been dedicated to raising awareness, sharing knowledge, and fostering a united effort against the global crisis of burn injuries, and also to make sure that we reduce the inequities. This inaugural Burn Week has highlighted crucial themes each day in the webinar, from current state to hidden costs, common responsibilities, and solutions. Today, as we close the webinar series, though the World Burn Week goes on for till Sunday, today we mark it as a day of commitment with a powerful tagline of commit and act. I think this day is a call to every individual, every organization and institute that is involved in burn care and prevention to not only commit to our shared goals, but also to take decisive actions. It's a reminder that real change in goals in burn care, whether you want to reduce your injuries, whether you want to improve treatment, or whether you want to support survivors, all of this requires both dedication as well as tangible steps if we have to go ahead. I think to conclude this meaningful week, this webinar is wonderful, and I'm honored to read the commitment document that has been signed by the presidents of various esteemed organizations. Some of these leaders and other members form the steering committee, and it is their dedication and collaborative efforts that has brought this first ever World Burn Week to all of you. This document reflects not only our shared goals, but also our collective commitment to addressing burn injuries as a critical global health issue. By signing this document, each of us reaffirms our commitment to the ideals of education, prevention, and empowerment, and most importantly, to acting on all these recommendations for the benefit of those impacted by burns. I will now read this commitment document that embodies our resolve to commit and act. On the occasion of the first World Burn Week, we, the undersigned presidents of various professional societies, come together in recognition of the World Burn Week and hereby declare our unwavering commitment to the following goals in the global fight against burn injuries. First, to educate and empower. We need to enhance public and professional knowledge about the global burden of burn injury, prevention, care, and recovery. Two, to reduce mortality. We would like to act towards lowering the mortality rate from burns by promoting timely and efficient access to quality burn care. We want to reduce morbidity. We want to lessen the physical, emotional, and psychological impact of burn injuries by supporting advancements in reconstructive surgery, rehabilitation, and long-term care. We want to prevent mass casualties, and in light of the potential for mass burn casualties during disasters, we want to work towards efficient protocols and hope that they are in place at the right places to prevent large-scale burn incidents and manage them effectively if they occur. We would like to reduce the burn load through prevention, and we advocate for the widespread adoption of safety measures, promote burn prevention awareness, and support legislation aimed at minimizing burn risks in everyday life. As we conclude World Burn Week, we reaffirm our dedication to these goals and call upon all individuals, organizations, and governments to join us in our mission to prevent burn injuries and improve the lives of all those affected by burns. So that's our commitment document, and which has been signed by the presidents of various organizations. I now call upon the presidents of various organizations or their representatives to speak on each organization's vision towards this commitment. David, would you like me to speak first then?
That would be great,
so I can
Vinita.
speak on the Asia Pacific Burn Association. Yeah. So as the president of the Asia Pacific Burn Association, I think I feel honored to speak about our shared mission to address burn injuries, which is major yet often neglected global health challenge. At APBA, we are fully committed to educating and empowering both professionals and the public to reduce the profound impact of burns. I would like to highlight APBA's role in educational and professional development. A core part of the Asia Pacific Burn Association's work involves creating consistent, high-quality opportunities for professional education. Every 2 years, the APBA conference brings together burn care experts, surgeons, researchers, and policymakers from across the Asia Pacific region. This gathering promotes knowledge, exchange on cutting-edge advancements in burn care, from acute management to reconstructive surgery, as well as strategies to improve patient outcomes and quality of life. Towards this education, in addition to the Asia Pacific Burn Conference, our quarterly webinars allow us to conduct a deep dive on specific burn topics. These are carefully selected based on current needs and the regional challenges. For example, our upcoming webinar focuses on managing burn disasters. And this is a subject which is critical to our region, where natural disasters as well as industrial incidents do happen in large scales at times. Through such focus sessions, we aim to equip burn care teams with the latest insights and protocols. APBA can also have a broader impact on burn prevention and community for the simple reason that all the members of the APBA are dedicated to prevention and community outreach. In the future, APBA is also looking forward to partnership with local bodies and the community in the Asia Pacific region, which is going to allow us to promote public awareness campaigns, create educational materials, and importantly, advocate for stronger safety legislation in their own country in our region. As we commemorate the World Burn Week, let us reaffirm our shared commitment to addressing burns as a pressing health crisis. APBA's work is built on the belief that through education, prevention, and collaboration, we can make a transformative impact on burn outcomes across our region. We invite all professionals, organizations, and communities in the Asia Pacific region to join us in this mission, together advancing towards a future where I hope that we have much lesser burn injuries, which are much less severe and are also met with better care. Thank you so much. Thank you. I now invite Siobhan from the ANZBA to speak on her vision for ANZBA.
Thank you, Vinita. Greetings, everyone from around the world, wherever you are. I acknowledge the traditional owners of all our lands and the powerful voice of our consumers. My name is Siobhan Connolly and I represent the Australian and New Zealand Burn Association, ANZBA, for this World Burns Week. ANZBA was established in 1976 as the peak body for multidisciplinary health professionals and experts responsible for the care of burn injured in Australia and New Zealand. We're dedicated to improving the lives of those affected by burn injury by encouraging higher standards of patient care through education, performance monitoring, research, and promoting community awareness of burn injury prevention. ANZBA's 4 pillars are care, prevention, education, and research. And we value collegiality and partnership to build strong, supportive, multidisciplinary networks amongst burn clinicians and consumers. ANZBA works closely with national and international bodies in both prevention and education with the aim of reducing the number and effects of burn injuries worldwide. We work to ensure those who do get burnt have equal access to quality burn care and support the fight to educate and empower all to tackle the hidden global crisis of burn injuries. We provide burn education to upskill local clinicians in burn patient management, including providing our Emergency Management of Severe Burns EMSB course. The EMSB was created by ANZBA and teaches how to recognise, assess, stabilise and transfer the severely burnt patient. It's been taught in many countries worldwide, and an adapted version for nursing and support staff is also taught, particularly in Pacific Islands such as Fiji, PNG, Solomon Islands and Timor-Leste. These courses are conducted as a train-the-trainer format so that the local clinicians carry on teaching from within and aim at sustainable process of educating and supporting. This reduces the financial burden on the regions which we teach and support. We acknowledge the great disparities and overrepresented numbers of burn injuries in LMICs and strive to correct this. We believe that prevention work is best undertaken in partnership with other organisations and agencies. We're dedicated to work alongside other burn organisations to provide resources and support for burn prevention initiatives nationally and internationally. ANZBA is particularly committed to our Pacific neighbours such as Fiji and Papua New Guinea, as well as any other nation. We're committed to developing and sharing resources to address burn injury prevention. ANZBA is committed to not only carrying out activities, but to also encourage and support others to do the same, particularly in this World Burns Week. Together, we can reduce burn numbers by prevention and education. We will join with a unified voice to raise awareness and close the gap. As I always say, let's put ourselves out of a job. Thank you.
Thank you. David, may we have the video of Renaud, since he's not able to speak live due to video issues. He'll be speaking on behalf of the Euro-Mediterranean Burn Council.
Ladies and gentlemen,
Great. Wow.
I am
Okay, you're on.
Ronan Le Floch, and I speak here on behalf of Béchar Atiyeh, who is the president of the MBC. Being Lebanese, he was not sure to be able to share this message, as well as being connected today. In the MBC's history and current activities lie its commitments among World Burns Week. MBC, Mediterranean Burns Club, was founded in June 1987, gathering doctors, scientists, and intellectuals involved in burns from all the Mediterranean countries. Its foundation act wrote, aim of creating a permanent dialogue on burns among specialists from countries of the Mediterranean basin, encourage the highest standard of burn care in all countries, and to bring to them the most valid contribution by all possible means, encourage cooperation among all countries through the exchange of information by all possible means. Aggregating other countries not touching the sea, it eventually became the Euro-Mediterranean Council for Burns and Fire Disasters, still known at MBC, the goals remaining identical: create a permanent dialogue on burns and fire disasters, a forum for the study and evaluation of the actual situation in the various individual countries, promote permanent contact and comparisons with regard to clinical, therapeutic, scientific, didactic, and nursing problems, and to endeavor to eliminate any gap that may exist. MBC has been granted collaborating center by the World Health Organization and special consultative by the United Nations, collaborating with these in major fire and humanitarian actions. MBC participated in the European Union's COMET2 program, aiming at the training of medical and paramedical staff specializing in the area of burns, fire disasters, and their prevention. Launched by the European Union again, MBC responded to a media program designed to reduce the region's informational and technological gap between neighboring countries. Developed by 17 burn centers around the Mediterranean Sea, it eventually led to the Burnet Web portal in 3 languages, Arabic, English, and French. This portal allows anyone, including children at school, via dedicated materials, to find information on burn treatment, home and emergency departments, among others, and their prevention. It rendered telemedicine possible. MBC provides both online courses and tutorials aiming at developing the skills in burn care all along the patient's route from firefighters to non-specialist doctors, as an example. Thanks to these instruments, it has been possible to organize public awareness campaigns on problems related to burn accidents and fire disasters. The MBC's journal, Annals of Burn and Fire Disasters, is bilingual, English-French, and open access, indexed in both PubMed and Scopus. Thanks to a modest editing fee and to its editorial line, it encourages others for the low and middle income countries to share their experiences and knowledge. As a summary, MBC is an organization which status and activities are in line with at least some goals of World Burns Week, and hopefully is able to both carry on and develop them as needed. Thank you very much.
Thank you. I now call upon Orlando Flores to speak about the vision of FELAQ.
Thank you very much, Vinita. Thank you very much, Ronan, for organizing this last webinar of the very first World Burns Week ever. My name is Orlando Flores, and I'm going to speak on behalf of the Federación Latinoamericana de Quemaduras, FELAQ. Quiero enviar en castellano un cordial saludo especialmente a nuestros colegas que están conectados a esta hora de la mañana desde distintos rincones de Latinoamérica, de España y de Portugal. Thank you very much. First, I would like to highlight that FELAQ and World Burns Week have shared values, vision, and mission. At FELAQ, we also believe that burns are to be prevented, and the access to timely and effective care should be equitable for everyone. We know that we need to foster the awareness of burns as a global health issue. We need to work in equity and access to burn prevention, care, rehabilitation, and especially to support burn survivors. And we know also that collaboration will reduce the burden of burns, especially in low and middle income countries. Our commitments start with education and empowering. FELAQ is deeply committed to enhancing our efforts to educate the very diverse Latin American community about the critical public health issue of burns. At FELAQ, we will strengthen our communication strategies to effectively engage with governments, policymakers, and the media, ensuring that our cause receives the attention it deserves. We are sure that together we will advocate for awareness and action in addressing this vital issue. We are also committed to reducing the mortality and morbidity caused by burns in our continent. We will intensify our efforts to enhance environmental safety throughout our continent and dedicate ourselves to optimizing access to specialized burn care for all who need it. Our goal is to significantly decrease the number of burn incidents and ensure equitable access to essential burn care, no matter where you are, no matter who you are. In terms of prevention, at FELAQ we firmly believe that prevention is the cornerstone of reducing the impact of burns across our continent. We are going to actively share strategies and ideas and implement programs that tailor the strategies to the specific needs of each country and each region in our continent. Our commitment is to collaborate closely with local teams, enhancing the quality of our prevention efforts but supporting every local team on designing and executing effective campaigns that reach everyone who needs it. And finally, we would like to, in the spirit of the first ever World Burns Week, support any effort that global collaboration can bring us in terms of uniting our effort, sharing knowledge, fostering partnerships across borders. Together, we are very sure we can develop innovative strategies and ensure equitable access to specialized burn care everywhere in the world. At the next FELAQ Congress in Quito, Ecuador, next year, FELAQ will host a special World Burns Week session dedicated to promoting initiatives that demonstrate collaborative efforts across our countries, but more especially across our continents. Thank you very much for having FELAQ as a part of the steering committee of the first ever World Burns Week, and you have our commitment to keep fighting for a better world for burn survivors. Thank you very much.
Thank you so much, Orlando. I think you having a session in the FELAQ conference next year is an amazing idea, and that is going to take the World Burn Week so much more ahead. Yeah, thank you so much. I now call upon Dr. Ariel Miranda, who is President-elect of the ISBI, to speak on the commitments of ISBI.
Hello.
Yeah, hi.
Hello, everyone. It's a pleasure look this wonderful session after 5 days of very intensive work. The ISBI have a lot of commitments, and one of those is this one, all that we say in the declaration. Dr. Carrington, our president, is not able to be here, but I'm here in his place. And one of my goals for the next 4 years is to have all these commitments effective in a very effective way. It's a pleasure to see people from all over the world, and we are on the same boat. We want to be in the same way to make the commitments effective. One of those is prevention, of course, training, education, and at the same time to have the best standards of care for the burn patients. From the ISBI and myself, the mass casualties guidelines is going to be one of my most important things to do in the next 4 years. And also a guidelines for prevention all over the world. As Orlando said, FELAQ is a very active society where people from all Latin America and even Spain and Portugal, we have been working on prevention and to have the best standards of care in all Latin America. And now we are committed to have the same standards all over the world. And the most important thing is to getting closer to the people and the areas who need us. ISBI want to be in the field, you know, in where we need to be, where, you know, the burns is a public health problem. Thank you very much, and I feel great to be with you this day. Thank you.
Thank you, Miranda, for speaking for the ISBI. May I now call upon Dr. Mamta Shah from the EBA.
David, can we have the video, please?
Good morning, good afternoon, good evening, ladies and gentlemen, and welcome to the final day of our World Burns Week presentations. My name is Mamta Shah and I represent the European Burns Association. The European Burns Association is strongly committed to sharing knowledge, collaborating with colleagues worldwide to raise awareness and support equitable burn care, prevention and survivorship, and strongly believes in the mission and vision of the WBW. In order to raise awareness, the APBA has recently performed a survey to map the main causes of burns across Europe and Latin America. And based on the data collected, the APBA is due to launch its campaign of prevention of scalds, the commonest cause of burns across the countries and in fact worldwide, sharing good practices and supporting others with resources already available for individual campaigns in their communities. The APBA is also stimulating research campaigns to support effective prevention programs. For education and support, the APBA has been influential in organizing and supporting mass casualty strategies and education along with Interburns across Europe, and is helping to train personnel in countries that do not have these skills. The APBA has regular educational webinars which are open to all participants worldwide. It also has and supports an exchange program for members of the multi-professional burn care team to share practices in different countries. The APBA has a program of verification of burn care providers and supports the centers to achieve the specification and standard of care, thus thriving to reach equitable care across the European nations and the United Kingdom. The APBA would actively work with other organizations to share skills and frameworks to support countries which fall behind the standard of care the WBW is aiming to achieve worldwide. This, in short, demonstrates the commitment of the European Burns Association in the mission and vision of the World Burns Week. Thank you for listening.
Thank you, Mamta. May I now call upon the Phoenix Society and call upon Amy Action to speak for Phoenix Society.
Amy's Amy's not here.
Amy's not there, okay. So in that case, may I call upon Lucy? Or do we have her?
I'm Amy.
Yeah, okay, okay, fine.
Sorry, Amy.
David, do we have a video? David, do we have Amy's video? May I now, in the meantime, request Lucy to speak on Interburns and their commitment?
Hi, everybody. It's great to see you all today. My name is Lucy King. I'm with Interburns, the International Network for Training, Education and Research in Burns. It's an honor to speak to you at the end of this World Burns Week. Our vision at Interburns is that all countries with limited resources implement effective burn prevention strategies and all patients with burn injuries receive good quality care despite limited resources. Our mission is to reduce the global incidence of burn injuries and improve outcomes by developing and implementing a comprehensive integrated approach to capacity building, quality improvement in burn care and prevention, targeting low resource environments. We are a global network. All our programs have been developed and delivered by mixed international teams of surgeons, nurses, therapists, nutritionists, psychologists, and public health experts, the majority from low resource settings. Many of our networks start out as participants on training programs and go on to become faculty and leaders. They're at the core of Interburns, from diverse countries and experiences coalescing around burns. I'd like to just talk to you quickly about the comprehensive framework for quality improvement and capacity building, because this is really at the core of what Interburns does, from setting standards to assessing burn services, to building capacity through education, training, research, and advocacy, and reviewing impact of interventions and iteratively improving them. Operational standards were developed by consensus in 2012 by 29 multidisciplinary burn leaders from around the world. The standards detail human and physical resources necessary and achievable in low resource settings, and sets out expected level of care and educational principles underlying them. The standards are linked to a self-assessment tool, the Delivery Assessment Tool, or the DAT, which is participatory focus group discussion around 10 key areas and helps the multidisciplinary burn team identify strengths and gaps in their burn service as a baseline for quality improvement initiatives. This is not an external assessment, but it is owned by the team. The DAT generates detailed notes and a color-coded scorecard that highlights strengths and gaps and can inform a plan for quality improvement. And it encourages the team to see that change can happen and find workable solutions. This is an example of a DAT run in a burn service and shows how focusing attention on priority areas can lead to change over time, shows evidence of impact, and Interburns works with burn units to support them in running the DAT, which is then useful for their own burn service, but also to generate funds for initiatives. The DAT has been run in many different countries and is freely available online at www.datforburns.org. Our training programs range from community burn prevention and basic burn care, which is ideal for remote rural areas or community level urban settings, to essential burn care, which covers the key aspects emergency to rehabilitation, and 3 modules in advanced burn care, nursing, surgery, and rehabilitation. These are 5-day specialist programs, followed by practical quality improvement projects. 2024 to 2025, our commitment to programs is as follows. We commit to encouraging and supporting burn services to carry out annual DAT assessments. We hope to open a regional hub in Africa, in Tanzania, alongside our regional hub Asia in Nepal. We are working on developing new programs, advanced burn care reconstruction, burns in conflict settings, essentials of burn rehabilitation, and developing burn specialist teams for mass casualty disasters. We will deliver capacity building programs with partners in the UAE, Sierra Leone, India, Pakistan, Nepal, Lebanon, and hopefully more. We'll provide mentorship, in particular to practical quality improvement projects using a tested 8-step approach. And we'll carry out research and support fellowships at our Interburns training centers in Ghana and Nepal. Commitments include those for collaboration. We collaborate with a number of different organizations, some of which are here, and we hope to collaborate with many more. We can only do this through collaboration, whether that's jointly running programs, training, or applying for funds together. This is a collaborative effort. We commit to advocacy through publications, research, presentation at conferences, and media engagement. And we mustn't forget fundraising, which is linked to all the above, and it's an essential player in all that has been discussed this week. It's extremely difficult to raise funds for burns, and we need to work together to make sure we generate funds in order to support these capacity building enterprises. We also commit to sharing our resources, many of which are already available online at www.interburns.org. We have several online courses, essential burn care, advanced burn care, quality improvement, and research writing skills. And we're also available on the UN Surge Hub. Our delivery assessment tool is freely available on datforburns.org. And please follow us on Facebook. Thank you very much. We look forward to taking knowledge into action throughout the next year until next World Burns Week. Thank you.
Thank you so much, Lucy. That was really wonderful. And your works do spread out across so many countries. It's really amazing. Been seeing the works of Interburns for a very long time. David, may we now have the video of Amy, Phoenix Society.
I'm Amy Acton, the CEO at the Phoenix Society for Burn Survivors, a US-based nonprofit with an increasing global reach. As a former burn nurse and burn survivor, I listen to the panels, share their experiences and the reflections highlighting burns as a hidden global crisis. The depth and cost to the individuals, families, care providers, and our communities is hard to fathom. I reflected on these losses from burn injuries that I've witnessed in my career alone, here at the Phoenix Society for the last 25 years and as a burn nurse. I feel the sorrow for the past losses we've all experienced, the 180,000 souls lost each year globally, and the millions more injured and living with varying disabilities. And we know that the low and middle income countries are carrying the greatest burden. Though every country experiences the inequities and barriers to quality care and the discrimination of those with burn injuries in our communities. I feel despair at the apathy and indifference to this global burn problem by others and the impact it has on our communities. I feel sadness knowing millions are alone in their burn recovery, lacking care and the connection they need to live successfully after their burn trauma. And I feel fear that the work we and our allies have done to advance quality care, recovery services, and the advancement of life safety codes could be dismantled and avoided by those who have nothing but financial gain or are ignorant to the true cost of their policy decisions. We embark on the inaugural World Burn Week to build a united coalition to grow awareness of the burn cause. It can feel daunting and quite frankly, a diversion from our kind of daily work that we all do in our burn entities. But if not us, then who? Who will advance and advocate this community? Who will advocate for us? It is this common purpose that brings us all together. This is not a sprint, but a marathon. And as survivors, we understand what it takes to reach our goals that others sometimes think are unattainable. The resilience and spirit of those who have fought back from a burn trauma with grace and courage and the support of one another, I think will inspire us in this work. We have a big, audacious vision to assure everyone who has access to the necessary burn care and the resources for true transformational healing. Advocating for the strategies to prevent injuries because we know that the best care of a burn is to prevent it in the first place. Each of you brings your experience and makes this new coalition one of the most formidable forces for change. A movement is greater than one person, one organization, and one country. We will advance the vision and bring the burn cause out of the shadows and into the light and make this world safer and provide equitable care wherever one lives. The Phoenix Society for Burn Survivors will continue to do our part, lifting up and sharing the story of those living with burn injuries and advocate for our needs for quality care, rehabilitation services, and greater understanding of the life of those living. We will bring the voices of our community forward to share the why prevention is a better way. We will continue to unite the survivor community from around the world at our World Burn Congress and through our virtual platforms to expand the access to peer support, building our voice so we can think not in fear or in pity, but in respect, in engagement, and quite frankly, to admire our resiliency and contributions that we can bring. We will continue to train and mentor survivors and their families and burn care providers to help one another through our SOAR program, our peer support program, easing the journey forward and sharing our survivor-informed resources with others. Lastly, we will continue to share survivor insights through our State of the Survivor report. Last year, we had 10 countries represented in the report. It was our second year, and we hope to continue to build the insights, the survivor-informed insights that we will need to improve care. The Phoenix Society for Burn Survivors stands with each of you to continue to promote and advocate for the goals of World Burn Week.
Thank you. Thank you, Amy. And thank you, David, for getting that video in. I think it's really nice that we could, sort of close all the speakers with the survival talk. I think it's really wonderful. It was really wonderful to hear about each of the organizations too from around the world, because each of them are actually working with their heart and soul towards burn care. I think all of us in this last year have gained inspiration from each other, knowing what what each organization is doing and working towards burn care. Let's carry this commitment with us beyond today. Let's carry this commitment for the whole year through, ensuring that every person, every organization, and every group that is involved with burn care pledges along with us today and transforms this pledge into something which is very meaningful, which is not just life-saving, but is also life-elevating. I now call upon David to close this webinar and also give his closing thoughts. Finally, this is the last webinar for the week. The G4 Alliance brought us all together. For the whole year, we've been working towards the World Burn Week. May I now call upon David, who has spearheaded this mission.
Thank you, Vinita. Yes, indeed. So as we celebrate these commitments which are really by the founding organizations of World Burns Week that we've just heard, we also need to remember that World Burns Week is a collective effort, which really only is ever as effective as it can make a tangible difference on the ground, right? So besides this webinar, there have been many different events and activities all over the world, and they've been, I'm sure you've seen them around whenever they're being publicized. But even those that are not being publicized, there is stuff going on and happening, and we are very, very appreciative and excited that World Burns Week is extending beyond just this webinar and actually onto and is able to make a tangible difference on the ground. So I want to speak to those of you who are watching right now, but also those who will be watching this recording later on. You might be a burn clinician, you might be a survivor, or even an industry representative, or even a politician. And I'd like to invite you to keep advocating for equity in your community, in your city, your state, your country. Let us keep collaborating with each other. We have an incredible platform here, which really presents us with a unique opportunity to stand in solidarity with the regions that carry most of the burden of burns, which are primarily low and middle income settings. And we want to lift their voices and work towards change. So let's keep doing that. Even now that we're reaching the end of World Burns Week, let's continue these efforts. Let's level the playing field. And at the same time, I'd like to say thank you to the steering committee, with whom I had the privilege and the honor to work with over the last, almost a year, I shall say. And we've heard from many of those representatives just now as they were able to speak to their organizations' commitments and what they can bring to the table. And so thank you for your continued work and your support and really making World Burns Week a reality. I also want to thank many of the endorsing partners. Maybe Natalie, if you're able to put on the slide. Wonderful. Yep. So these are the many different organizations. As you can see, we have over 70 organizations at this stage that have endorsed us. These are endorsing partners. Very hard to put them onto a slide, very hard to even read for you. I apologize for that, but it's a good thing because there's so many. And so I want to thank them because without you, this would not have become a reality, and it wouldn't be a reality on the ground. So I thank all the people behind the scenes, that have helped in the brainstorming, the planning, and envisioning of what this could be like. We've now had, I think, around 1,100 or 200 registrants for even just for the webinar series. And of course, we're reaching far more people on the ground that we're not being able to track. So thank you, thank you, thank you. While this is not the end of World Burns Week 2024, because we still have this weekend to go, it's the end of the webinar series, so this is the last time that you'll see our faces. However, I do already want to extend the invitation to you for the next year's World Burns Week 2025, which will be from the 3rd of November to the 9th of November. So did I say that right? Yeah, 3rd to the 9th, yeah, correct. So thank you for tuning in, and let's finish this webinar.
Thank you. Bye, everyone.